Hi, everyone. Okay, we have our topic on lower back. We have gone through the neck positioning. We've gone through mid back positioning. Now we are on to our lower back positioning, which is very important. One of the things, who doesn't have lower back pain? If you really ask around, everybody's got lower back pain somewhat in one way or the other. And oftentimes, did you know that the best way to prevent your lower back pain from occurring or getting worse is to have a good posture? So I'm going to start with the basic anatomy, have a little review of what happens in our back and how does it look and why does it happen. This is our, what we call core. A lot of the time people don't think about core. Core means it's really all the way around from front to back and to the side. And you have the oblique, and besides the rectus abdominis, which is what we call six pack, we got a lot more. We got the transverse, we got the oblique muscle, we have the muscles in the back, really on the side, and it goes all the way around. And this core muscle, often when we train, we don't think about. This is, by the way, if you don't know what you're looking at, this is the back, this is your buttock muscle. Okay, these two are your buttock muscle. All these muscle that comes all the way to the crust of your back, which is your back muscle, goes all the way down to your crust. And then your leg muscle goes all the way to the top back part of your crust. So if you don't stretch your legs, you probably will have higher risk of having back pain. And so this is why I always often ask anyone or everyone who have tight legs to keep stretching, because you could prevent tension, spasm, and all that. This is latissimus dorsi. Now, do realize that all these have yellow little lines. These are the nervous system. This is like the detection. You know, it's almost like you drive your car, and if you have low gas, you have a little wire detecting that you have no gas, light turned on. If you have muscle spasm or tight muscle, one more than the other, that means any one of these tiny little nerve can be pinched. We call impingement syndrome. Once it's pinched, if you stretch your muscle out, you may be lucky that little tingling, soreness, achiness, pain goes away. If it doesn't, then something else deeper is happening. If we take out the outer layer, this is the inner layer. Now do notice, see how long these muscles are? And the most deepest layer, you got some quite long muscles and also short muscles. Short muscles to the rib cage, and it goes down to the lower back. And this is from the front view. Here's one really special muscle. This is called the iliopsoas muscle, which is from the front of your lumbar, and it goes down to your big bone, your thigh bone. So this is the powerful leg flexor muscle, which means every time you sit and stand and you walk, you use this muscle. But how often are you stretching it? It's part of your top 10 stretches. By looking at that, this is part side view of your rib cage. And below your rib cage, you got these muscles that are attached from the crust all the way to the rib cage. And then you have this is trapezius. All these, what I'm trying to say here is that contributes to your core muscle. If you often stretch that and have a good posture, you have less problem on the inside. So let's talk about lumbar sitting. I often said, when you sit, stick a butt out. Why do I say stick a butt out? When you arch your back, some people will jam their chest forward. So that doesn't work as well. But if you rock your pelvis, right now, go ahead, and if you're seated, just go ahead and rock your pelvis forward and back. Rock it a little bit. Really feel that. You will feel this rocking pelvis motion will increase your lumbar curve. Most of the time when we sit, we have our back touch, but we lose our lumbar curve. So that's very important. That's why when I often ask you to sit, I want you to stick a butt out. That's the main reason. As for meditation, yoga, sitting, same thing. This is the rotation of the pelvis. Okay. And this is why it's really important. If you sit on the floor, there's no cushion. Do notice that if you have cushion, it rocks your pelvis forward. If you sit all day, then it's best to have a little lumbar cushion so that it preserves the curve. And you can still sit with your back touch, your head touch onto the chair, and you can kind of relax and do your work. All you need is your finger and eye movement. Say you sit on the floor, you lose that curve. And also there's tension pulling from your legs And this is the iliopsoas that I showed you earlier, and all your paraspinal muscles. And all these muscles actually are contracted, whether you sit, stand, or walk. The only time you don't use your muscle is when you lay down. There's some stretches that you can do, which is very simple, very easy, warrior pose or bend over, cross leg. These are the best ones where it's really simple and you just breathe. I know stretching is the most boringest thing that people don't have the stamina or holding. We count breath. We breathe in, we breathe out. We count that as one. Breathe in and breathe out 10 times is the best. The nice, easy rotational stretches that gets all are these. Just open your legs, cross over and breathe. If you can't hold on to your leg, hold on to your knee. If you can't hold on to your knee, hold on to the table. Don't just pose because there's higher chance for you to sprain your back. Okay. Simple stretches like these are the best. Why do I say that? Because partially you get your legs. Remember I said earlier, you have to stretch your leg muscle at the same time you're stretching your lower back muscle. It's the best because everything is connected to the ilium. Okay. All right. Some people like to sit and they like to cross over and lean. This gets your oblique muscles on your core and your back, and you get a little bit of your glutes. It gets all. Now, if you're sitting in front of your desk, you could simply do the same thing. Lean over and touch to the desktop. You don't have to be on the floor. You don't have to have a mat. These are very, very simple things you can do front and back. Very simple. It gets all. Now, of course, this model is super flexible, but the key is if you stretch a little bit of your back muscle, the combination with breathing. Once again, why is breathing more important? See, all these muscles are attached onto the rib cage. So if you're actually breathing in and out, it gets that extra deep tendon muscle that you need to get rid of them. This is a class. We're not doing the stretching class. I'm just running through the things that you can do to help you. And these should be the minimal things: rotation, lateral flexion. These are very simple. You could cross your leg, or you don't have to cross your leg. You could simply sit on the chair and grab onto the back of the chair. And these are simple things that you can do. Oftentimes people say, oh, how do I have a curve? How does curve involve? How does it occur? Well, it's very simple. It's overusage or habits. Can you imagine? The blue is shortened muscle. The short muscle, that just means that overcontracted, overused. And then you got the red that's being lengthened, meaning being pulled. For everything that's attached to us, everything go back to the spine. It goes back to the center. In the front, it goes to the sternum. And in the back, it goes to the spine. The only time that you can often check yourself is by stretching every day to know which side is tighter. Stretch that tighter side. And that's very important. The key is this: stretching is checkup. Stretching is checking to see if your left and your right, which one is tighter, then stretch the tighter side. A lot of the time people says, well, how do I know? Well, all you have to do is have somebody look at your shoulder blade. You can see the height difference of that edge of your shoulder blade. That's one thing. Some people have a little hump. If they're bent over, you could see a higher rib cage one side than the other. These are all signs. As long as they're not even, that means you have uneven contracture of your muscle. Now, when we talk about the core, I want you to think about not just the rectus abdominis, which is the front, with your six-pack muscle. Breathing is really important. There's tension inside. I want you to think about breathing in and out into your tummy. Okay, so when we talk about this, there's something I wanted to show you. How often do you breathe into using your deep muscle to pull your diaphragm down? When you do that, you actually train to use your core muscle. Here's the example. I'm going to shift another. I found this video of this monk doing this abdominal breathing. Take a look at this. And I'm quite amazed with this. He breathes in. See how that stomach comes out? And then he exhales. The whole entire thing sucks in. Wow. Okay. So once again, he breathes in. Okay. You see that? That's amazing, isn't it? And then he exhales, really contracts, and that really pushes in. That's contracting everything. Okay, let's take a short practice. Let's have you do this the same way. Try to breathe in. Breathe in and just extend that. Really push your tummy out. And then exhale, really push, 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 push. Okay, it's doable. It's not doable. I want you to really think that this is something we should often practice. If we don't practice, we don't know that this muscle is actually in use. And if you often tighten your core, often I ask you to just poke at your stomach. Is it tense? Is it tightening? Besides the fat layer on the outside, you will feel it on the inside. I want you to often practice breathing in and out by contracting your abs. Okay. And then you will feel the side abdominal muscles working as well. And this will help you strengthen your entire posture for your lumbar. This is what we call the iliopsoas muscle that I showed you earlier. With this muscle being tight, which goes to your thigh bone, this is from walking up and down the stairs, walking every day. All these tension can build up. And if you have pain in that region, it could go down to your buttock. See, this is that same muscle. The X marks as in if there's pain there, you may have feeling of soreness in the groin area, in the back, lower back area. A lot of times I've seen a lot of patients that with lower back pain, it's really not disc issue. It's just tight muscle. And we just help them stretch out their muscle and then the pain goes away. Okay. And so I wanted to show you videos of how we could utilize some of the equipments that I actually have given you, such as a little ball. Let's see. Okay. The use of ball, we could go against the wall to roll up and down. Okay, this is something very, very simple that you can do. Okay. And if oftentimes you have time, use this ball to roll and shift side to side. Notice that he's shifting side to side. And then now he's shifting his hip side of that. There's rotation. Earlier was rotation. If you look at this, if you go against the wall, this is hip rotation with a buttock. This is hip side to side shifting. Okay. And then after that, you have others you can do. You can lay down and put your weight on it and rest your back completely down. And you lift your butt up and then you can rotate and shift. Okay. You can rotate and shift side to side. This is pretty easy. Now, for some people, if you're not on the floor, you're in bed, it may be a little bit harder to get that traction. But if you shift side to side, it gets to those deeper muscle sets. Okay. You can simply not move at all and just relax. As you relax, your lower back will have that nice pressure and you can open your leg to one side versus the other. That also stretch your inner groin area and your lower back area. These are very simple things that you can do every day before you go to sleep to get rid of those deeper set muscles. Okay. And the more you breathe, the better your back will relax on its own. Okay. So let's look at this again. You would drop. Now, the other way is you drop your shoulder to relax and you could stabilize yourself by putting your arms down and just move your hip onto the side. Okay. And sometimes people tend to roll off. So if you roll off, it's okay as long as you're stabilized. You drop your arm down to stabilize yourself. And this will be helpful. Okay. By relaxing these deeper set muscles, it will help you and prevent disc issues. What we're seeing nowadays, in these days, what I'm seeing the most is that people don't have enough core muscle, meaning they're kind of weak. Okay. And often especially in this pandemic year, in the past 2 years, I have to recommend more strengthening, core strengthening than stretching. It was a lot more strengthening needed because everyone is sitting and not moving as much. Okay. So core strengthening became something that's very important. Oftentimes, we don't lift anything squatting down to this much. It's a 90-degree squat. If we look at a side view, that's a nice back and then as a nice squat. So the easiest thing I recommend patients to do is that if you can often in the morning, start squatting up and down by lifting anything of your choice. Squat down to 90 degrees and then lift it up over your head. This is a very good morning warm up for your entire day. From there, I'm going to quickly show you some pictures of what protrusion of our disc could happen. Okay, a lot of time we don't think about this, but if you really think about it, disc protrusion, after your muscle tension is tight enough, it'll compress your disc lopsided. Imagine one side of your back is tight and then you sit for a long time. That protrusion could bulge. We call disc bulge, disc protrusion. It could get to a little postlateral to one side. If that's your right side of your nerve, goes down to your leg, you probably feel it on your right side. Okay, if it's in the center, you may feel it on both sides. If this is in the neck, you may feel it on your arms and sometimes down your legs. If this is only on your lumbar, then you feel it down from your legs, only from lumbar down. There's what we call herniation, and it could actually burst into something worse. And you can see the picture here. And when it actually separates itself, this is when you really need surgery. Not much we can do as chiropractors. Okay, your body may reabsorb it itself if you're lucky, but if it doesn't take away, you could have a long-term pain, and you're not sure which is which. It's always best to consult a professional. Okay, if usually we see these type of patients, their pain is constant. It's almost constant until they lay down or face down. All right, so we're going to end the session. Thank you all for coming. Next month, we'll be talking about pelvic exercise a little bit.